before I'm looking for any signs, flags, or precautions. There are none, so I am going to knock and enter. Knock, knock.
Come on in.
I am providing privacy by closing the door and was doing hand hygiene as I walk in. Hi, my name is Young. I'm your nurse today. How are you?
I'm doing okay, thanks. How are you?
Good. I'm here to do your head-to-toe assessment before you meet your doctor. And can you tell me your name and date of birth?
My name is Rachel. My date of birth is 7/2/80.
All right. May I see your armband?
Yeah.
Perfect. That totally matches. And can you tell me where you are right now?
I'm in the hospital.
Do you know what date it is?
It is Friday, July 24th, 2020.
And what brings you in today?
I'm just here for a checkup.
Perfect. So from that, I can tell that my patient is conscious, alert, and oriented ×3. Her responses were appropriate with no confusion or slurring. And upon visual inspection, I can see that she is her stated age, or looks to be her stated age. She seems to be in good health. Her skin is appropriate for her color, appropriate color for her ethnicity, and she does not seem to be in any pain or distress. Her facial expressions, affect, and mood seem pleasant. Her posture is upright, and there are no medical equipment or assistive devices for mobility. She seems to be in good nutritional to have good nutritional status. She has good hygiene, and she is dressed appropriately for the season. All right. So first, I'm just going to take your vital signs, starting with your pulse, your respirations, and your blood pressure.
Okay.
All right. And hello. May I have you put your arm just like this? And all right. Thank you. All right, thank you. All right, next I'm going to take your blood pressure. May I get you to remove your sleeve for me? All right, and are you in any pain at all?
I'm not, no.
No? All right, and may I get you to put your arm just like that again?
Thank you.
All right. So her vitals, her radial pulse is 62. Her respiration rate is 20 breaths per minute, and then her blood pressure is 124/80. All right. And while I was taking her vitals, I was also inspecting her face, head, and eyes and mouth. Sorry, we are wearing masks right now, but let's pretend that I can see her face. All right, so in normal assessments, I would usually feel her head to make sure that, to check the contours and check her hair distribution and hair for like cleanliness and any wounds, lesions, or infestations. And then I would also, so her skin on her face is clear, it's free of any kind of redness, wounds, or lesions. Her lips, let's say we can see them, are pink and free of dryness. Her oral mucous membrane is pink and moist, and her teeth are intact. Her sclerae are white. Her facial features are symmetric and aligned properly. Her eyes are aligned with the tops of her ears, and her sclerae are white. I might have already said that. And in a normal assessment, I would also pull down her lower lids to check her conjunctivae to assess that they are pink and moist. But I don't want to touch her eyes right now. All right, and all right, and then next I am going to just examine your eyes. Is that okay?
Yeah, that's great.
All right, and I'm going to shine a light in your eye, just a warning. All right, so look into the distance for me. All right, can you focus on the tip of my pen? All right. All right, keep focusing and just move your eyes only. All right, great. So her pupils are equal in size. They are round, reactive to light, and accommodating. And she was able to follow my pen when I did the main cardinal directions. And based on the presence of perla and her ability to follow my pen light with her eyes, I can say that her cranial nerves for vision 2, 3, 4, and 6 are intact. And can you bite down for me? And bite down. Bite down. All right, and then can I keep touching your face?
Mm-hmm.
All right, can you close your eyes for me and tell me where you feel my hand?
My forehead, my chin, my left cheek, my right cheek.
All right, and let's see. All right, and can you lower your face mask for me real quick? And can you smile? Frown? Puff out your cheeks? Raise your eyebrows? All right, based on her ability to feel sensation in her face, her ability to symmetrical facial expressions, and then the contraction of her temporal and masseter muscles when she bites down, you can tell that her trigeminal facial cranial nerves 5 and 7 are intact. And sorry, can you lower your mask for me again? Can you stick out your tongue and say ah? Oh, you have a tongue ring. And can you stick out your tongue and move it side to side? And then can you say light, tight, dynamite?
Light, tight, dynamite.
All right, based on her ability to perform those actions, you can say that her cranial nerves for her mouth, 5, 7, 9, 10, and 12 are intact. And then, may I approach?
Yes.
All right, can you try to shrug your shoulders? And then, can I put my hand on your face? Can you turn your head against my hand? And then other side. All right. So her ability to turn her head against resistance as well as shrug against resistance shows that her spinal cranial nerve number 12 is, cranial spinal cranial nerve 11 is intact. Alright, and then may I just take a look at your throat? And may I touch your throat? Alright, so her neck is symmetrical along the midline, and by feeling around the trachea, I can see that there's no signs that she has an enlarged thyroid gland. And can I get you to turn your head to the left? There's also no sign of jugular vein distension. Alright. And then, are you experiencing any cough or sputum?
I'm not, no.
Any shortness of breath or chest pain?
Mm-mm.
Alright, and may I get you to expose your chest for me? Alright, and so I'm just going to do a chest examination. I'm just going to examine your chest area.
Okay.
Alright. So, just inspecting it, the skin is normal. The skin color is normal for the patient. There is no sign of any wounds or lesions, no tubing, no drainage, no dressings, and there's no sign of pulsation at any of her cardiac locations or at the PMI. And I'm just going to feel around. I'm just going to feel your chest really quick. Alright, and alright, so there were no thrills at any of the cardiac sites, and there was a pulse at the PMI, and now I'm just gonna listen to your heart sounds really quick. Alright, thank you. Alright, so when auscultating, I heard S1 and S2 sounds at every cardiac location, and there was a murmur when I listened to the mitral location. Sorry. Alright, and now I'm just gonna listen for your lung sounds real quick. And
Mm-hmm.
and whenever you feel my stethoscope, can you take a deep breath for me? and so on auscultating her lung sounds, it sounds like her air is entering her lungs clearly in all lobes on both sides, right and left. And and may I get you to turn around and expose may I get you to expose the back of your. Thank you. So on inspection, her posterior thorax is symmetrical. The skin color is appropriate for the patient, and I'm just gonna feel the back of your chest wall. Alright, there are no abnormal masses or lumps, no wounds, lesions, or dressing, and everything is symmetrical. And can you breathe in for me? Alright, and breathe in. Alright, and there is no sign of crepitus. There was also no sign of crepitus in the front. And her her ribs are expanding smoothly and evenly and symmetrically. Alright, when you feel my stethoscope, can you breathe in for me? Actually, can you turn around so that your legs
On the side?
yeah, so that Alright, can you breathe in for me? Breathe in. Alright, thank you. And while there are no abnormal lumps, lesions, or wounds, there is a birthmark just here. Alright, and if you want, you can put your jacket back on.
99.
Oh, sorry, I forgot to do a check for tactile firmness, so I'll do that now. Alright, and when you feel my hand, can you say 99?
99. I took a breath. 99.
Sorry.
99. 99. 99. 99. 99. 99. 99.
Alright, so there's no sign of a tactile firmness. Alright, and next we are going to move on to your extremities. So, oh wait, I'll give you a chance to put your jacket back on. Alright, so, may I, so when I push down, can you try to lift your arm? And then try to put it back. Try to flex your arm back down. And then, can you grasp my hand? Alright, and then, may I examine your nails? Alright, and may I get you to try to push your arm up, down, up, extend, grasp my hand. Alright, and then, alright, and may I check your radial pulse? Oh, go ahead and. Alright, so her muscle, So her muscle strength seems to be within normal limits. Her muscle tone is good, and she was able to grasp my hands. Her capillary refill is 3 seconds, and her fingernail beds are pink. And all right, may I assess your lower extremities? All right. All right, may I get you to lift your leg, back down. Try to extend your knee, and then back down, and then try to lift your foot, back down. May I get you to try to lift your leg, down, extend your knee, and then back down, and lift your foot, back down. All right, and so muscle tone seems to be good. Oh, may I get you to take your shoes off real quick? Alright, so the skin on the lower extremities is warm and dry, and texture is normal, and skin color is appropriate. There's no signs of pitting edema. The pulse on her posterior tibialis and her dorsalis pedis are present. And oh, go ahead and put your shoes back on if you'd like. All right. And when was your last bowel movement?
This morning.
All right. Was there any issues or abnormalities?
No,
And are you experiencing nausea or vomiting?
I'm not. No.
All right. Any pain in your abdominal pain?
Mm-mm.
All right. And may I get you to lie down? All right. Are you comfortable? And may I expose your abdomen?
Yeah. Do you want to do tank top up too?
You can leave your tank top on. All right. So the contours of her her abdomen are normal. There's nothing, no abnormal lumps or wounds or drainage. No sign of ostomies, and it just looks to be flat. And I am going to listen to your stomach. Is that okay?
Yeah.
Alright. I'll go on the other side. Alright, so there were bowel sounds in all 4 quadrants, and they sounded normal, not hyperactive. And if you feel any pain, let me know, but I'm just going to press on your abdomen a little bit. Alright, her abdominal wall is soft. There doesn't seem to be any abnormal contours or lumps, and her skin is warm and dry. And did you feel any pain while I was pressing down?
No.
Any pain when I was lifting my hands?
No.
All right. And can I get you to lift your knees? All right. And ooh,
I'm sorry. I dropped something.
yeah, here you go. All right. And let me just pull this back down for you.
Thank you.
All right. And have you been experiencing any abnormalities when you urinate?
No. Mm-mm.
No incontinence?
No.
All right. And what color is your urine generally?
Yellow, light yellow.
Any odor?
No.
All right. And then, so she does not have a Foley catheter. And do you have any problems in your perineal area?
No, everything seems comfortable.
Alright, so usually in a normal assessment, I would assess her perineal area if indicated, but in this case, not today. Alright, and so I'm gonna turn you over, but you might need to help me a little bit. Alright, and may I lift your shirt?
Yeah, there's.
Alright, so upon examining her back, I see no reddened areas in her back, buttocks, heels, or any bony prominences. Her skin is still intact and show no sign of skin breakdown. And may I get you to turn that over? Alright, and if you'd like to sit up, you can, but you don't have to. Alright, so I'm gonna call your doctor in. Here's your call light. The bed is locked and low, and then and your doctor will be in shortly. I am going to wash my hands and perform hand hygiene, and then document my findings. Oh, and I forgot when I was doing cranial nerve, I forgot to test a couple things. Can you grasp my hands? Alright, and then can you put your hands downward and then close your eyes. Alright, she was able to properly grasp my hands and there is no sign of pronation drift.